Good morning and welcome, and thank you all for joining us for this important conversation today. As we mark International Women's Day, many discussions rightly celebrate progress. But today, we want to focus on something more structural: the invisible phases of women's health that remain under recognized, under researched, and often under supported. When we talk about women's health, the narrative frequently centers around a narrow set of life stages. Yet, across APAC and Middle East, millions of women navigate complex hormonal transitions, chronic conditions, mental health burdens, and workplace challenges that are still minimized, misdiagnosed, and culturally silenced. These are not marginal issues, these are workforce issues, these are economic issues. Today's conversation is not just about awareness, it is about accountability. It is about asking whether we are designing systems that truly reflect women's lived realities across age, ethnicity, income, and geography. I'm delighted to be joined by an exceptional panel of leaders who bring perspectives from innovation, policy, industry collaboration, and patient centered care. Please join me in welcoming Rachel Lee, Global Head of Communications, Advanced MedTech, Sung Lee, Executive Director for Communications and Patient Advocacy, Novartis, taking care of Asia Pacific, Middle East, and Africa region. Last but not the least, Masooma Pathre, Director Communications, Strategic Marketing Function for Medtronic EurAsia. Welcome, ladies, and so good to have you all here.
Hi, Shivani.
Hello. Thanks for having us.
Let's get started with the first question, of course, which I think all of us would love to talk about and share points. So my first question I'll begin with Rachel. When we say invisible phases of women's health, what does that mean to you, Rachel?
I think it really, thank you again for having me. I think I was really excited to join because it was a topic that was really close to me, and is exactly, the point that you made about invisible phases. That for women's health is not a straightforward linear process. A lot of us go through many different, sort of life stages and also different hormonal related changes. And a lot of it is invisible. It's the fact that it's not really spoken or discussed a lot. And it's also that women are conscious of it to a point, and they are mindful to kind of keep it quite private, right? Some of it is quite sensitive. So I think, that is really what it means to me. The fact that women could be suffering very quietly, could also be going through certain challenges. But the truth is, it is more common than we think, and it should be something that we should all feel very comfortable to talk a lot more about.
Absolutely, totally agree. Sang, what would you want to say on this?
Let's just say women go through life stages in a more pronounced way than men. So our bodies actually change, right? Dramatically, starting with childbirth and our monthly cycles. And then I'm going through perimenopause right now, and I can list 10 things that I struggled with alone just last year. So men can be seen, but women are being looked at. So this is a quote I happened to see from the book that Annie Leibovitz, she's famous for taking portraits of women. And this actually means that we are being really judged based on appearance and based on how we take care of ourselves. So I think our reality and perception and the stigma attached to it warrants a conversation like this.
Absolutely. Very valid points. Masooma?
I think, first of all, thank you very much for this platform and having us. I absolutely agree with Rachel and so. I just want to, they've really kind of, outlined what it really means in different phases, right? I just want to add that it also is about how women feel in different phases. When we go through these different phases, we feel different things, we think different ways, and we even perform in a different manner because of what our bodies are going through. I think one of the biggest challenges that, as I think Sunga Rachel said, that it's not spoken much. And it's also not part of the system because the system is not made with that perspective of mind, keeping in mind what are women's life phases are, right? So for me, it still remains invisible for the reason that it's maybe not intentional. It's just that it was never in the system.
Absolutely. I think so many important points that we have touched upon. It's brilliant. Of course, then we talk about the health transition phases, which are invisible. So my next question on that to Rachel would be, Rachel, why are we still not talking enough on it, on topics like perimenopause, menopause, hormonal shifts, though there have been, very minimalist conversations here and there, which are probably not so connected and not so structured. Why is not there enough conversation?
I think it's a bit of a lack of understanding of what it means, and what actually happens. I think also culturally in society, it can be pretty sensitive. It could be almost also slightly dismissed as, oh, it's a women's private matter. It's not openly discussed and is deemed sometimes in some cultures maybe not very respectful to talk about it. You should keep it to yourself. And I think I also would like to argue that, especially in sort of, the healthcare space, physicians still has a challenge to actually listen very intensely to some of the concerns that women have, and not, and try to prevent their own personal biases, to dismiss concerns. I think that continues to be an area of opportunity and growth, actually. And I think, finally at the workplace, I mean, it's pretty hardcore. You're expected to perform at 100% despite going through health transitions. Like exactly what Song had mentioned before, when you have a child, when you're breastfeeding, when your body has completely changed, when you're going through hormonal shifts, perimenopause and menopause and everything, it's actually not feasible for women to be able to do it all and be at 100% at every single stage that we go through. So I think that really does impact a women's leadership journey, but also at the workplace, but also in society.
So true. Masooma, would you want to add to
Um,
this?
Yeah, I mean, as Rachel said, I think one of the most important thing is that it's very private, especially culturally. People think that these are not matters that need to be discussed openly, especially if I'm working in an environment where I'm the only female. And we
Mm,
know as you climb
Yeah,
up the journey, I mean, look at, I'm also going through perimenopause. And you're actually at a time in your journey when you're really at an influential position. You are in those leadership boardrooms, but you
yeah,
are surrounded by men. Now that becomes like a little awkward because they don't know what you are going through, and you are definitely not, built culturally to speak about it openly. And then it
yeah,
becomes like a hush hush conversation, or I don't know why she's not talking much today in this room, or why she's quiet. But we
yeah,
know, I mean, there's something going on which is really either fogging our brain,
yeah.
or there are different things that happen, right? And it's not that we are enjoying it, and it's not an excuse also. But I
Totally.
think this is one of the reasons why it's not being taught. Because by the time you reach this stage, you are at this influential career phase where actually you do not have enough people around you who are talking about those phases.
Oh, yes, absolutely. So true. Some you would want to add to this, please?
Yeah, I think I would add that, just looking back, last year I traveled a lot for work. It's a new role, and I have a male superior, right? So I was required to travel to the US after a long flight. And then the day one of meeting, my period hits. I never had heavy flow, right? Just for first time in my life, it just heavy, irregular. Sometimes I get twice a month, you name it, right? It really affects you, your ability to show up and perform at your full self, even though mentally I want to. But you just feel like you need to sleep it off, but you still force yourself to go to the meeting, but you stay quiet just because it's so draining. At the end of the day, my boss asked me over dinner, right, at the site while we were walking back, what happened to you? You seem very quiet. I don't know how to answer him, right? I would just, oh
Exactly.
yeah, time of the month,
Mm,
you try to brush it off. I think
yeah,
it boils down to, we are confused ourselves, right? What's going on? You're trying to, entangle in a web yourself. Like, why is this happening? I need to get to the bottom of it. I'm just so exhausted. I don't know what's wrong. There's a lot of what's wrong going on. And then you go through this journey of being very confused, very isolated, and you still want to show up. So it's never straightforward, the path. And I think it really helps me when I start to talk to other colleagues, female colleagues at work, and then they reciprocate, yeah, I'm having the same thing, brain fog.
Yeah.
And you see more senior female leaders saying that in private though. Then I realized, actually, if you connect the dots and more people talk about it, it can actually normalize this. And I would have gone back to my boss and just state it as it is. So I think women's stories are just not being taken seriously.
Absolutely. And I think it's important for people to feel that it's for real. It's not that, it's an excuse, because I've been hearing these podcasts and conversations where in fact, I don't want to name the celebrities, where they actually mentioned that, it's, let's not hide behind this and make this as an excuse for things, which is funny, because which clearly shows that even educated people also probably do not understand this, that this is for real. So yeah, rightly said, all the points totally. My next question, Masooma, to you would be, how do invisible health transitions impact women's leadership journey?
Oh my God, it's for real. I must say, it impacts confidence, it impacts our risk-taking ability, depending on what phase of life a woman is in. Uh, it impacts. We don't like how some just mentioned. You don't know what's happening to your body. And then what happens is, because of that, you internalize the problem because you think there's a problem with me. Maybe I'm underconfident. Maybe I'm underprepared. Maybe this is not the right time for me to take a stretch project. You absolutely get into self-doubt because of various reasons. Your body is tired, your brain is tired. And many a times I also feel, and I've seen women that they decline stretch projects or promotions because of these phases, because they feel they will not be able to do it or they'll be not able to manage it, right? And I think the loss isn't of the woman itself. I think the loss is of the organization also
Oh,
in a big
yes.
manner, because you're actually losing a talent who's really amazing, but maybe she's not in a right phase of mind. And this is where, those conversations with colleagues and all really help you. And I've really had this conversation during when I was pregnant and I'm ready about to deliver, and I had a big project in front of me, and I said, maybe I cannot come back and take it. You might want to consider someone else. And my boss at that time said, no, this is not a disease. You will
Oh,
come back.
brilliant.
Yeah, you
Brilliant.
will come back, and we will wait for you. So yeah, I
Wow.
mean, it does impact the transition, but it's also about the ecosystem.
Absolutely. And I think ecosystem and the allies that you have, whether it's an ally with a woman or men, and also it's like you said, it's not just the growth of the organization, is the overall economy that we are talking about, the economic growth of the country, of the nation overall. Yes. And so what do you think are the trade-offs focusing on the present day and the role of leadership for women, Rachel?
Yeah, I think, one trade-off, and I always remember this quote in this interview with the CEO of PepsiCo, Indra Nooyi, when she was asked, can women have it all?
No.
And the answer is no. I don't think that women can have it all. And, she said it's an illusion. She also mentioned that how, biologically, your biological clock and your career clock are in total conflict of each other. So I think, we pretend that we can have it all. And for me, I always remembered how that was resonating with me, because in this context and in this topic, it is literally also the trade-offs that you make as a female professional about wanting to show up, wanting to be there, taking the meeting, taking the project, taking the promotion, doing the travel, but you trade off with your presence, maybe your presence at home, your presence with your family, with your spouse, with your partner, and with your health.
Oh,
So I
yes.
think we can be honest with each other. There are a lot of times, and I can speak for myself, I was too exhausted. I was too exhausted to go to the gym. I was too exhausted. I would make excuses for myself. I'll put it off. I will ignore the signals that my body is giving to me because I want to show up. I want to do the job. I want to be the best person for
Yeah.
that role and that responsibility. That's a big trade-off. And
Yeah.
the bigger question is, should that trade-off actually exist? Could there be, to Masooma's point, a better ecosystem, a better situation where you would feel comfortable to have a very honest conversation like, I want to be the best I can be, and thank you for the trust, but I'm actually struggling. And, and not feel that your career is at stake. For me, those are some of the trade-offs.
Absolutely. And again, to the same point of, like ecosystem and how comfortable you can feel with each other and within your organization. Sang, would you want to add to this?
Yeah. I think it's hard to change the system overnight, right? It has to be built. So International Women's Day is just an annual touch point, right? But what organizations can do is go beyond that day. Think about how you can cover your corporate health screenings for women diseases, because if you're over 40, over 50, you're at increased risk, right, of osteoporosis,
Yeah.
female cancers, the list goes on, cardiovascular disease. Those are the obvious ones, but you might not even think of dental care, right? Yeah, but menopause with the hormone decline, it significant affects our gum
Yeah.
health. And then what about brain fog? No one talks about, right? The middle of the workday, and then you feel sluggish after lunch. So I think, can we make our work hours more flexible? So that inclusivity will go a long way.
That's brilliant, brilliant point. It's such a important point because today, in fact, I was thinking that I don't know somehow why am I having brain fog today? I mean, I'm supposed to be recording the webinar also, and why? But I was like, when this is the whole example, this is the live example we are sharing because when you get into this conversation as the allyship and also the comfort, then you're completely fine to perform the way you would want to. So yeah, I think this is a live example here. So, yeah, my next question definitely would be more about what we touched upon. What policies or cultural shifts are still missing here? Masuma, would you want to say something on that?
I think, okay, many organizations do recognize it, but I think the basic thing that's missing is acknowledging that women do have different phases in life,
Yeah,
from childbirth to, perimenopause to menopause, and that needs to be acknowledged, right? That has to be normalized. It is normal, and this is
yeah,
going to happen. I think so. That is one basic thing that needs to be acknowledged and taken into consideration when policies are made.
yeah,
Now, fairness doesn't mean sameness. What I need during my perimenopause journey may not be the same that somebody else needs, right? And that's why what is essential is that we need to look at policies which are holistic. You can definitely have, my organization has 1 day menstrual off in India. I mean, that's a new policy, right? But maybe that's not something that I want. I really want maybe that I just want a day off because I'm not going to make it, the day is not going to be great for me. Or I need a wellness program, or like Sung said, where everything is encompassing for all kind of women health requirements. Or it could be just basic psychological safety to speak up about this problem and make the managers aware and be more inclusive without a bias, right? So I think it's a very holistic thing. It's a long way. It cannot
yeah.
happen in 1 day. It has to be step by step. If I have to put it in one line, I think we need to design the policies for a longer term. It's
No,
not just designed for now, next day, 6 months, or 1 year. It has to be designed for a longer duration.
absolutely. So brilliant. Yeah, brilliant points. Rachel, would you want to add to that?
I'll bring it maybe closer to home, which is in Singapore. One of the
Mm-hmm.
hot topics that is dominating the news for the past week was we have a very low fertility rate in Singapore, one of the lowest in the world. right?
Yeah.
And,
Yeah.
one of the, and there's been a working task force that's actually been put together to address marriage and parenthood, right? And looking at a society-wide reset. And I point that out because I'm trying to, it really is so brilliant what Masooma had just said, which is from a policy standpoint, even for the government, there is a role that a government can play. So that life
Yeah.
stage is literally, probably the sort of the first big life stage for a woman, which is, do I want to consider having children? It's a big decision. But for women to feel safe to even consider it, she needs to look at her environment. And if I decide to plan for a family, how will that affect my career? Do I feel safe to have it? Women go through a lot. Every single woman have a different childbirth experience, a different breastfeeding experience, a very different environment. And, do we have policies in place now at workplaces where they feel their job is protected, where they feel they will not be discriminated if they change a job tomorrow and they decide to apply for a job and a new employer, are they allowed to ask that question? Are you planning a family? It's a very sensitive thing. We don't really always, even that is like tenuous to even mention, but it exists. And I think those are, for me, okay, from a policy standpoint, there's something that we can explore there. Or even maternity or paternity leave. Is there more improvements that we can do so that both men and women, husband and wife, partners feel that they are able to support each other in that life change? So I think that, is so important. I think there is a role that even governments can play, not just on the workplace, but on a very like sort of national, policy standpoint can change.
Absolutely. And I think the amazing, brilliant points you all are sharing, and of course, when we talk about building policies, so that this makes me think that are we designing these policies and solutions for women, or are we including women and designing them with women? So maybe, Sang, would you want to take that up?
Yeah, I think I already touched on that, right? But it goes
Yeah.
beyond just celebration, right? The policy level. So talk about your health screening and wellness program, right? Or other kind of sports activities you can incorporate, because fitness becomes so important when you have muscle loss over the age of 40. I think the other piece that we can incorporate as a solution is in the workplace is really about connection, right? That you can share symptoms and support each other, maybe through some therapies or counseling sessions as well, that people can just share and openly create that safe space, that, the psychological safety we're talking about. And let's not forget the men, right? Because in order to get this right in the workplace, we'll need the male allyship to be holistic.
Yeah, I agree totally. Sang, do you want to, sorry, Rachel, would you want to add to that?
I think some solutions that I've seen that is practical also and useful is, there has been better digital tools for women to use. So, I use, various different tools where, even in your fitness tracker, for example, you can track
Yeah.
your women's cycle. You can also track symptoms that you're going through. I find that quite helpful on a practical level when I go see my physician, or you do your annual and be like, when was your last period? Or what was your
Yeah.
symptoms so far when you do your annual gynecology? Very uncomfortable, but yes, your annual gynae meeting, and you want to go through certain changes. And it is kind of useful to kind of track it down actually, because then you can have a very detailed conversation about what your struggles are and what your symptoms are and how they can actually, is there a pattern and how they can help. So I find that also on a practical level really nice to have those options rather than just like writing and scribbling and you lose the paper. You literally just have it on your
Exactly.
phone and you have a bit of a like data basically that you can use.
Yeah, I'm sure there is an advanced version of it which must be somewhere in making to kind of help the organizations to come up with such solutions. So, yeah, actually, this digital health brings me to another question, which Masooma probably, I would like to ask you. What role digital health can play in bridging equity gaps?
I agree with what just Rachel said, right? If I can track what's happening with me, and that's one way, right? So tracking is one thing. I think the other important thing is to also be able to help interpret. If this is happening to me, this is what I'm going to experience, right? This way, what happens is if you have that data, you know that you're not alone. This is normal. I think that's again very much needed, to this whole confidence building for women personally, right? Otherwise, you get into this trap, and especially when you work remote now, which is so often with most of us, you just get into this trap all alone. Oh, what's happening? Why I'm not able to, just sail through after lunchtime, and I'm slogging. I'm not able to complete my
Yeah,
work. I'm not able to contribute to this meeting. I just don't feel like sitting in this meeting, right? But if you have this communities where you know that this is normal,
yeah,
I think we need to, digital platforms can actually help really make you feel not alone, make you feel seen, heard, and even shared. So I think what is needed is one is tracking, and secondly, also to have those lived experiences or what we're discussing today, right? Or
yeah,
even networks where I can really discuss this and feel, yes, this is normal. And I
yeah,
will say it too, with support. So I think
yeah.
digital will play a very important role there.
Yeah, absolutely. And I'm sure as the innovation and advancement happens, it's going to be taking care of that. So, Sang, since we were discussing about digital health, and I think some great points Masuma made. And would you want to add in terms of what role does digital health play in bridging the equity gaps?
I really had to think hard about these equity gaps, right? Because it's a big topic. But I think if we just narrow down to the last 5 to 6 years, um, two things: COVID and AI have pushed health information in the forefront. So I can talk to Grab drivers; they will be talking about different vaccines, which one is more effective. And then AI, my friends can send me a summary of different treatments out there that makes innovation hard to explain, but people can make their own assessment. So I would say that it is so accessible now. And if you remember earlier, I talked about perimenopause and menopause being a very isolated journey. But I think this shift in technology makes it easier for women to search in their fingertips and get help, find symptoms than before, right? And we need to then create that openness to break down the walls that they can get out of their digital
Yeah,
device and be able to then connect getting symptoms to seeking the right answers. I think there is still a wall preventing women from finding, instead of going down a rabbit hole to finding the right solution and the right treatment or pathways to cope with their symptoms. Most of the time, they just pray things will go away, right? So I think the journey is it's not it's very confusing on top of gynae visits, scans, reports, and sometimes you just can't find anything conclusive. So one thing is information overload. The other thing is also credibility of online sources. How can we as an industry, right, support this, making sure that there are not a lot of fake news, right? Whatever is women needs to find is available and is trustable. So that would be one way. Even though internet adoption is widespread, it doesn't mean it gets to everyone.
exactly. I think, yeah, this is such a brilliant point again. So, yeah, I think we all have been seeing and having these conversations, which are pretty great. So, my last question to each one of you, and would love to, I'm sure everyone will want to hear this. One change you would like to see in how our industry approaches women's health, though we have touched upon, but something like one change, maybe. Let's start with Rachel.
I would echo what we've been saying a few times, which is normalize it. It's normal. It
Yeah,
is doesn't mean that it translate to hormonal changes and life changes does not translate to ineffectiveness. and an inability to perform. It's just a very normal physical change that happens to women. The more we normalize and we talk about it, the better. That's one change.
Absolutely. Normalize it. Totally. Sang, what would you want to say?
I guess the one change I want to see is really women are living longer, and how can we support each other to stay more active? Not only the workplace needs to evolve through updated policies, but also we need to take control of our own health, right?
Yeah.
So if you think about it, I was in Okinawa over the holidays, and I see how come the people in their 70s and 80s are still working, if not volunteering or dancing. And Singapore now is the worst, like the sixth blue zone, with centenarians doubling in the past decade. So we need to have a positive mindset. And
Yeah.
then with deliberate preparation, then we can finance and then build the support we want. So I think it starts with us understanding what we are going through,
Yeah.
and the society will evolve.
Brilliant. Yeah. It's taking control of your own health. So true. Masooma, what would you want to say?
I think for me, one of the most important thing would be to have women's health integrated into our leadership and talent discussions. I think that is very much needed, that we acknowledge it, normalize it,
Yeah.
and design systems where it actually does not weaken the performance, like as Rachel mentioned, right? We don't want to weaken anyone's performance. We don't want
Right.
policies which will push us back in our careers, but would help us to transition better when we are back from whatever phase we are going, right? And I think
Right.
this is where leadership will have to play a very important role, and talent discussions will have to play a very important. We need to be
Absolutely.
seen, and we need to be acknowledged, and we need to normalize this so that no opportunity is taken away from us or from any woman because of the phase that she is in her life. So we need to really design to support, rather than design to just include.
Absolutely. I think brilliant points. That is, more about inclusivity and design to support. So yeah, we have great points. Normalize and take control of your health and design to support with inclusivity. If we can create a nice Venn diagram out of this, I'm sure, and if between government and private sectors, there can be a beautiful set of policies, and I'm sure the nation and the organizations are gonna go, like it's gonna be way beyond economic growth, which is expected. Thank you so much. It was a lovely conversation. And like we said, it's not about awareness, it was about accountability also. So we have moved beyond that and we have touched upon some great, great points here. Thank you, lovely ladies. And
Thank
it was
you.
brilliant having this conversation with you
Thank you.
all.
Thank you very
Thank
much
you
Happy
for
so
having
much.
Women's
us.
Day.
Thank
Thank
you.
Take care.
Happy
you.
Women's Day.